Hi everyone, my name is Mandy Brosher and I wanted to take this opportunity to tell you about my course, The Functional Pelvis. Physios are scared of the pelvis and you don't have to be. This course is for neuromusculoskeletal therapists practicing in outpatient departments, treating backs, hips, groins. If you are treating any of those things, you need to know about the pelvic floor. You don't necessarily have to be doing internal exams to know about the pelvic floor. And actually, it's really important if you are not keen to do internal exams to know about the pelvic floor so you can know when to refer to someone who can do an internal exam. So I wanted to show you a little bit of anatomy so you can see that actually you are dealing with the pelvic floor every single day and that it's important for you to know what's going on. So you can see this is obviously the most superficial layer. Here's your glute max and all your hamstrings. So if we peel that glute max away, we've got our glute med and glute min, and here's our piriformis, and we always talk about treating the piriformis. And here are our gemellis, and there is a little muscle there peeping through called obturator internus. And if you have ever done any deep posterior glute release, you are probably fiddling with obturator internus. If we have a look at this side, this is looking from the back. So here's our coccyx, but here's our pubic symphysis. So put your 3D brain on. And here's that obturator internus. And you can see how it's coming from the inside of the pelvis and popping out onto the femur. And here are our gemelli muscles over there, and here's our piriformis. Here's the scary picture, this pelvic floor, but you don't have to be scared because you know some of the muscles already, because this is piriformis. So you can see how it attaches onto the sacrum and then it actually pops out behind the pelvis. So then we have these pelvic floor muscles. These are the deep pelvic floor muscles, and they've got fancy names, and we can learn about them later. But they are in such close connection to all the other ones that you're actually probably dealing with them a lot of the time. I like this view because now we're looking down into the pelvis. So you can see piriformis here. And now we've got these muscles called coccygeus, iliococcygeus. This one is called pubococcygeus because it goes from the pubic bone to the coccyx. And then we have puborectalis, which loops around the rectum, goes from the pubic bone around the rectum. And then have a look here. We've got that obturator internus, which starts inside the pelvis and then goes through the obturator foramen out to the hip. So if you are treating hips, groins, backs, and you don't know about what's going on with these muscles inside the pelvic floor, you're missing a big part of it. You don't have to be scared of the pelvic floor. And I think a lot of people have been put off pelvic courses because they don't want to do internal exams. Well, my course is online, so we are keeping undies on. And I want to teach you about the basics. I want to teach you basic pelvic floor anatomy, basic bladder and bowel, just screening so you can pick up problems, know how far you can go as a musculoskeletal therapist and when you need to move on to a women's health therapist. We're going to do autonomic nervous system because if your patient has chronic back pain, chronic hip pain, adductor pain, abdominal pain, anything like that, they more than likely have a tight pelvic floor, and there's a lot you can do to help them to relax it. The other thing we're going to be looking at is clinical presentations. Diastasis rectus abdominis. How many of you are treating moms that have had 3 children and are very fit runners, but they have this little bit of a mummy tummy? Have you looked if they have a diastasis? Are they having back pain? Are you asking if they have pulling sensations sort of in their pelvic area? Maybe they've got a prolapse that needs to be managed. So there's so much screening that needs to happen with general back pain, hip pain, groin pain, and actually neck pain as well, that this is what this course is, to give you the basics. And then you can make a decision. Do you want to move on to the next step and learn how to do internals? But that is not what this course is about. This course is about equipping you to help patients that you are already treating, but just making sure that you're getting the entire kinetic chain. Because if you are telling patients that you are treating their entire kinetic chain and you don't know what's going on in that pelvic floor, then maybe you aren't. So I want to empower musculoskeletal physios to learn about the pelvis, to realize that it's not scary at all, and to give you tips and tricks on what to do with your patients that is absolutely safe for you to do, and to know what your limitations are and when to refer on to someone else. So hopefully I see you then.